So the ECHELON-1 study was a very large, global, so international multi-center study in the frontline treatment of patients with advanced stage 3-4 classical Hodgkin lymphoma. It was a very straightforward study, simply comparing ABVD with AVD Brentuximab, and the results were presented actually last year. But what we've been seeing at ASH this year is various subgroups being presented. So we've seen the older subgroup presented, and we've seen a younger sort of TYA, teenage young adult subgroup presented. And essentially what we see is that in the teenage young adult population, the PFS advantage for AVD Brentuximab vedotin is very clear. So there is a definite benefit in progression-free survival in that age group. The controversy is that actually there's probably even better results obtained with more intensive chemotherapy in the form of escalated BEACOPP or escalated BEACOPP-DAC. So now we have 3 different regimes we can use. We have ABVD, which is perhaps the gold standard globally. We have AVD Brentuximab presented here at ASH, which is associated with some improvement of PFS, but is quite an expensive regime and is associated with excess toxicity, more neutropenia, more neuropathy. And also we have a more dose-intense chemotherapy regime, which is a relatively old regime now, escalated BEACOPP, which probably has the best results in terms of disease control, but also has probably the highest rates of toxicity. So again, it's going to be a matter now of with these 3 options, individualizing it to our patients and discussing the risks and benefits in order to maximize their outcomes.